and an author. She is an associate clinical professor at the University of Arizona College of Medicine in Phoenix, and she has her own abortion clinic called Desert Star, where she's training with medical students from all over the world, from all over the US and from Canada as well. And she has written a book about abortion and all the stuff that's been happening recently with Roe v. Wade and the Supreme Court policies. And so just a reminder before we start the session, please keep your mics off unless asked to do so. If you have any questions, please type them in the chat, and please be respectful to all of our speakers. This session is being recorded, so if you don't want to be in the recording, please turn off your cameras and get rid of your last name so that you won't be able to be identified from the video. And if you're ready, Dr. DeShawn Taylor, please. Yeah.
Okay, so I have a couple of more minutes. So I am a board certified gynecology and family planning specialist. I'm a gender affirming care provider. My clinic integrates abortion care with all of the services that I provide. It's on the record as an independent abortion clinic because abortion is healthcare, and I lean into the abortion care I provide, but I'm a board certified obstetrician gynecologist. My book, Undue Burden, a Black woman physician on being Christian and pro-abortion in the reproductive justice movement, is a clarion call to stop siloing abortion and start to talk about abortion as part of a spectrum of decisions that people make when they're pregnant, and that people aren't making the decision to have an abortion in a silo, in a vacuum. They're making it in the context of their whole lives. And so the book helps people move from that singular focus of abortion as an individual right to how the society can create the conditions for people to holistically care for themselves and their bodies. So today, I'm going to be talking about your period and birth control. And I see that it's not 10:30 yet, and I heard that there was a break happening. So I know that there may be some people needing to come back. So I will give that extra couple of minutes in case people were specifically waiting for the 10:30 time to come back, if that's okay? Or does it look like everyone's here?
If you would like to wait, then we can wait a few minutes, I think.
Yeah. Because I know I'm one of those people who don't come back until the time that the break is supposed to be over.
Yeah.
Okay. So I will be talking to you all today about your periods and birth control. Did you know that your periods can be a window into how healthy you are? You should have regular periods unless you are pregnant, breastfeeding, postmenopausal, or have a medical condition that causes your periods to stop. Irregular, painful, or heavy periods may be a sign of a serious health problem. Irregular periods also can make it harder to get pregnant. And on the other side of that, it's difficult for you to know when you're fertile to avoid sexual activity if you don't want to become pregnant. Your menstrual period is the cyclical shedding of the lining of the uterus. Your menstrual cycle begins with the first day of bleeding with your period and ends with the first day of the next period. And the purpose is to prepare for pregnancy. A normal menstrual cycle is 21 to 35 days, with the average being about 28 days. And we expect for you to have about 3 to 7 days of bleeding. And so again, this means that the time frame from the first day of full bleeding during your last period up to the start of your next period is at least 21 days, but no more than 35 days. Some people's periods are so regular that they can predict the day and time that their periods will start. Others are regular, but can only predict the start of their period within a few days. And so the duration of the time that you'll be menstruating is from puberty to menopause. Now, the cyclical rise and fall of the hormones, estrogen and progesterone, powers the menstrual cycle, causing changes in the lining of the uterus that occurs in phases. This graphic shows 5 distinct areas, which I think is a nice way to look at it because it adds in the time that the uterine lining is starting to detach before the actual flow of the period. So you did not become pregnant, the hormone levels are falling, very low levels of estrogen and progesterone tell the body to begin menstruation. And so this is often the time where you might start to have cramping with a little bit of spotty bleeding, but the actual period starts with the obvious flow of blood, not the spotting. And so the way that we are looking at this is the first week, 1 to 7 days or so, is when we're expecting the actual flow of blood. And this is the menstrual phase. So the uterine lining is shedding, estrogen and progesterone levels are at their lowest point. Then as we're coming out of menstruation, we have rising estrogen levels that cause the lining of the uterus to thicken to prepare for the implantation of a pregnancy. The other thing that's happening in the ovary is that follicles are starting to mature to determine which one is actually going to ovulate the egg. And so the ovulatory phase in general, ovulation occurs mid-cycle. But the time between ovulation and the next period starts can vary among people. Some people, it's as short as a week. For others, it can be more than 2 weeks. And this varies from person to person. But what's important about the ovulatory phase is that pregnancy is most likely to occur when sex without birth control happens within the 3 days before ovulation and up to the day of the actual ovulation. And so the sperm already need to be in the tube ready to fertilize the egg as soon as it's released. The other important thing is sperm can live up to 5 days in the fallopian tubes. So we're talking about your menstrual cycle. We're talking about the things that are happening in the uterus, but it's also important to have a little bit of idea of the other parts of what's happening as it relates to your ability to become pregnant or your risk of becoming pregnant. The other thing is estrogen levels are the highest during this ovulatory phase. And then we have what's called the luteal phase, and progesterone is the dominating hormone now to maintain a potential pregnancy. There's a structure called a corpus luteum that is maintaining the progesterone levels to support a pregnancy. The corpus luteum fades away over time, and hormones drop if a pregnancy doesn't occur. And so you've ovulated, you have not become pregnant, estrogen and progesterone levels fall, the lining of the uterus starts to detach, and then you start your cycle all over again. Your periods require medical attention if they are painful, long, heavy, make you feel tired, weak, or dizzy, or skips several months. And so pain during the period is of concern when it's not relieved with over-the-counter pain remedies or things like heating pads, that home remedies. Or when we're talking about long, your period lasts 8 days or longer, because I mentioned the average length of a period. A normal period is about 3 to 7 days. In terms of heavy, if you're bleeding through one or more pads or tampons every 1 to 2 hours, that's heavy. Also, if you're passing blood clots larger than the size of quarters, it's normal to pass clots during the period, but they're generally smaller than that. If you're feeling dizzy, lightheaded, weak, or tired, or if you have chest pain or trouble breathing during or after the period, this could be symptoms of something called anemia. And anemia is a condition that happens when your blood cannot carry enough oxygen through your body because of lack of iron. And so these symptoms can be a sign of that. Spotting or bleeding anytime in the menstrual cycle other than during your period could be a sign of something else happening. And also if you do not get your period in 3 months. And so at that point, when someone's missed their period for several months in a row, then we have a concern that there may be some type of a hormonal imbalance that is causing the lack of menstruation. And so further evaluation is definitely important. In my practice, I'll see people who come in for pregnancy and their periods are irregular, and some people are further along pregnant than they expected, and some people are less pregnant than they expected because they don't have regular periods. And they've gotten so used to not seeing their period regularly that there's no way for them to know at all when they're fertile. And so it's really important that when you're wanting to avoid pregnancy, that you have a better understanding of when you're fertile so you can avoid pregnancy. And most period problems can be managed with hormonal birth control. It is the hormone progestin that prevents ovulation. And that's why we can have progestin-only methods of birth control. Estrogen is added to birth control to enhance that effect, but mainly the estrogen helps to prevent irregular shedding of the uterine lining. And that decreases unwanted breakthrough bleeding. And so that is why when you have a combined hormonal contraceptive method, that has both estrogen and progestin in it, you have a regular, predictable period. And this is what we call cycle control. And so 4 ways that birth control improves your period symptoms is if you're using a combination method, which is the birth control pill, patch, or ring. The estrogen in the birth control provides the cycle control. The progestin in birth control also thins the inner lining of the uterus. The progestin effect is more prominent, therefore you see improvement in the period flow. So the progestin in birth control improves period flow. Just by the mechanism of action, combined hormonal contraceptives treats long, heavy, and irregular periods. Now, keep in mind that when you're on a hormonal contraceptive, you are not experiencing a real period as part of the menstrual cycle. Monthly bleeding on most hormonal contraceptives is caused by a different process in your body. And so this is called a withdrawal bleeding. In layman's term, I still refer to it as a period when I'm talking to patients, but basically the combination of the hormones have recreated your 28-day menstrual cycle. And so the bleeding that's happening from that is not a physiological process from your own natural hormones in your body. It's been created by the birth control. So when the menstrual cycle is happening naturally, estrogen and progesterone levels fall, and a hormone-like substance called prostaglandin is released from the endometrial cells, which are the cells of the uterine lining, as they lose hormonal support. And so this causes contractions of the uterus that further expel the uterine lining. So hormonal contraceptives impact this natural increase in prostaglandins before the period starts, which decreases painful menstruation. It may take up to 3 cycles for menstrual pain to noticeably diminish. So hormonal contraceptives decrease painful menstruation through this mechanism. Taking extended cycle combination pills without a break or with fewer breaks, or even with no breaks, might improve pain better than the actual 21 days of active pill, 7-day break traditional cycle. So extended cycle combination pills may improve pain better. Using hormonal birth control can change your period. And so it's really important that people have a better understanding of what's happening when they're taking hormonal birth control to manage any side effects or concerns, or be able to bring the concerns to your healthcare provider. So as I mentioned, your natural cycle isn't occurring when you're on a combination hormonal birth control. It's basically giving you a certain level of estrogen, a certain level of progesterone daily. There are multiple different combinations that try to replicate the menstrual cycle, but I personally like the ones what we call monophasic, where it's the same dose of hormones every day, because part of the symptoms that people have from their period is due to the fluctuations of hormones as they go up and down throughout the cycle. And so if we are having someone who is using hormonal birth control to manage the symptoms of their period, then it's my preference that someone is on a preparation that has the same level of hormones every day. And so once a traditional birth control pill pack is set up with 3 weeks of pills that have the hormones in them and 1 week of pills that's hormone free. And so you take 1 pill around the same time every day. Ideally, if you forget to take that pill exactly at the same time, as long as you remember it daily, then it's going to work for you to prevent pregnancy. And it's also going to give you the cycle control that you need. Oftentimes, when people are having irregular bleeding and they're on combination hormonal contraceptives, is because they're skipping pills. And so when you start to have the decrease in the hormone level circulating in your body, then, as I previously mentioned, when the endometrial cells lose the hormonal support, then the prostaglandins kick in, and then it starts to have the lining of the uterus detached, which at minimum can cause spotting, and at more in actual flow if you've missed several days of the period of the pills. So Another thing that happens is when people are using progestin-only contraceptives, then the estrogen isn't there to support the lining of the uterus. And so the progestin-only pills really change your period in a way that you can have unpredictable shedding of the lining, which can be cumbersome to people. And then you have certain methods that, due to their mechanisms of action, stop people from having periods altogether. And so I did not make any additional slides to kind of show you what the different types of progestin-only contraceptives are, but we're going to go through a spectrum so you can kind of understand that when people are using birth control that doesn't have estrogen in it, there are some things that change. I will say that there are times when there is a preference to provide someone a progestin-only contraceptive to manage their heavy, painful periods. Because the progestin is something that really, it doesn't stimulate the lining of the uterus. There are people who have a condition called endometriosis. And so that is a condition where the tissue, the endometrial cells that should be inside the inner lining of the uterus are outside of the uterus and in other places of the pelvis. And so using a progestin-only method of birth control actually improves people's symptoms related to that, really improves the pain associated with the endometriosis. And so a condition like that, for example, a progestin-only method of birth control could be a preferred method for those people, even though we could use a combined hormonal contraceptive, but we'll use it in an extended manner where they don't have any breaks in the hormones so that they can have the relief from having a bleeding period at all and improve their overall quality of life. So we have progestin-only pills, we have the birth control implant, Nexplanon, we have hormone-releasing IUDs, the intrauterine device, Mirena, Liletta, there are multiple. And so people who are really good at taking pills every day can do the progestin-only pill. The reason that someone would do a progestin-only pill as opposed to a combined hormonal contraceptive is if they are breastfeeding. If they're breastfeeding early postpartum, the estrogen can decrease the milk formation. But when and then there's also the concern of blood clots because a person can still be at risk for those early on postpartum. But then once the milk has fully set in and they're further out from the risk of having cardiovascular effects from estrogen, then they can be switched over to combined hormonal contraceptives. There's also some medical conditions that make it unsafe for people to have estrogen in their birth control, so they use progestin-only pills. So honestly, for me, when I am thinking about someone's period and conditions that they're having related to their period, the progestin-only pill is actually not a top option that I like to use to manage period-related symptoms. Then the next option that we have, I forgot to mention the Depo-Provera shot. So the next option we have is the Depo-Provera shot. And so the Depo shot is an injection every 3 months. And most people on the Depo shot do not have periods. And one of the reasons that happens is because you start with the high level of the progestin, and it pretty much impacts the higher brain signals of the hormones that come from the pituitary to influence the cycle. And so people don't menstruate. And so over the course of time, the levels of the hormone decrease, and you think of every 3 months as like a booster to keep up the contraceptive level of the birth control. Now, what's really nice about this is because it has that side effect of shutting down the period for most people, then this becomes a really good method of treating heavy, painful periods for people who would not otherwise be good candidates or remember to take pills every day. The other nice thing about it is it's a really good method of birth control where it's there. You don't have to think about it until you have to get the next shot. I will say that, again, because there's no estrogen in this, then there is the risk of unscheduled bleeding. And so there is a subset of people who discontinue the Depo-Provera shot because they're actually bleeding too much. And so that is a concern there. But I like the Depo-Provera, and especially for young teenagers who have busy lives and remember to take pills can be problematic. And athletes also like to stop their period with the Depo-Provera as well. And again, they don't have to remember to take a pill every day and don't have to worry about their menses when they're competing, et cetera. And then we have the birth control implant, Nexplanon. Now, this one is an interesting one because it doesn't necessarily suppress the natural body's estrogen like the Depo-Provera shot does. And so there is a little bit of sufficient maintaining of your estrogen levels and the lining of the endometrium when someone is taking using the Nexplanon implant. So the Nexplanon implant is not necessarily something that I use to specifically manage someone's menstrual symptoms, but it is an excellent forgettable form of birth control. Because we don't have the estrogen included in the method, then there is not the full support of the endometrium. And so there can be unscheduled bleeding with this method. And so when people are using the implant, most people have a regular, predictable period, but then can have some unscheduled spotting throughout the cycle. And for some people, it's not a nuisance enough to discontinue the method, but for others, it is a reason that they discontinue that birth control method. So again, it's an excellent method for birth control, but its bleeding profile makes it not a method that I would generally prescribe to people when there is a main concern with how their periods are impacting their life. And then we have the hormone releasing IUDs, which is my absolute favorite to control heavy, painful periods. The hormone releasing IUD, Mirena, was the first one that was marketed here, and now there are several others. But what it does is it releases the hormone progestin into the uterus directly. And so it thins out the lining of the uterus. And then the other way that it prevents pregnancy is it makes the mucus of the cervix really thick. And so sperm are not able to enter through the cervix to get to the tube to hang out to wait for the ovulation to occur. And so because it thins out the lining of the uterus, that people are guaranteed a lighter, less painful period. And then there is a percentage of people who don't have a period at all on that method. And that is absolutely fine to not have a period when the period is being stopped by your hormonal birth control. And so that is an overview that I wanted to provide to you all. And I wanted to leave a good amount of time for questions. So let's do that.
Okay, so there's one question. Is it hard to get off of birth control after using it for a while? Because you had mentioned that you get spotting if you don't regularly take the pills.
Do we have any questions?
There's one that said, is it hard to get off of birth control after using it for a while? Because I know you said that spotting can happen if you don't regularly take pills. Dr. Taylor, can you hear me?
Maylene, are you speaking? Because I can't hear you.
Oh, I am speaking. Okay.
Okay, let me adjust because I'm not hearing. Okay, go ahead again.
Okay, can you hear me?
Yeah.
Okay. So one question was, is it hard to get off of birth control after using it for a while? Because you know, I know that you said that spotting can happen if you don't regularly take pills. So if you just stop taking birth control pills, is there some sort of withdrawal that will happen in your body?
So the thing about the combination hormonal contraceptives, the pill, the patch, or the ring, as soon as you stop taking it, then your natural cycle kicks in pretty quickly. And so there isn't any delay with that. The only hormonal contraceptive that where there is a delay for your natural cycle to return is the Depo-Provera shot. There can be a delay of 6 to 9 months on average, and sometimes shorter, sometimes longer.
Okay. And there's another question that asked, if you don't take Depo-Provera, if you take the Depo-Provera shot or something else that stops menstruation, then will you go into menopause later than usual?
So there have been some studies that have followed a group of women who are postmenopausal and had taken the Depo-Provera shot for a significant part of their fertile years. And the study found that these people did not have any increase in osteoporosis or fractures. In terms of how long you're fertile, we're born with the number of eggs that we're going to have. So our fertility wanes over time, just based on age, regardless of if you used hormonal contraceptives or not. No matter if you didn't ovulate every moment that your body potentially could have done that. There is a process called atresia, which means that the follicles just start to shrink away and go away over the course of time, whether you've ovulated them or not.
Okay, and then I have one last question. Are there any symptoms or risks or side effects or risks that come with taking birth control that you should be worried about?
So it's every medication has a side effect. And I think that it's really interesting how when we are addressing medications that are related to people's reproduction, that there is such a significant focus on what those effects are. And there is now finally some really good momentum on having a birth control pill over the counter. There's been some recent reporting about that. But when I'm talking to people about birth control, then I generally break it down into minor and major side effects. And so some of the minor side effects are things like stomach upset, nausea, some mild mood changes, that generally will improve after someone's taking the birth control for a couple of cycles. But I generally tell people that if the side effects are really cumbersome to them, they can always do a pill switch because there are so many different formulations of pills. And sometimes it's a matter of the hormone dose, the actual brand and the fillers that they use in the brand. Like I've had people say, oh, you prescribed this one pill to me and now the pharmacy is giving me a different one and I feel different on it. I'm like, well, it's the same hormone. So maybe there is some type of interaction that's happening based on whatever the additional fillers that whatever company is using for the pills. And so generally people bear the minor side effects. And I tell people if you have nausea, for example, then take it at night before bed. To help with that. And then you have more major side effects that would be a reason to discontinue the pills immediately and seek medical attention. And so generally, these are more related. There's a class labeling, so these risks are on all of the methods, even the progestin only. But honestly, the cardiovascular stuff is related to the estrogen content of the pill. So when you're on the combination pill, patch or ring, there is a risk of heart attack, there's a risk of stroke, there's a risk of blood clots in the legs and lungs. And this risk is related to a few things. One is age. As we get older, there are natural changes to our arteries, atherosclerosis and estrogen can have an impact on that, which you can clog the arteries, you can have spasms, which leads to strokes, et cetera, heart attacks, et cetera. The other important thing beyond age is smoking. So if you have a completely healthy person who's made it beyond 30 and they've never smoked in their lives, they're actual and they've in their normal weight, and then generally their risk profile on age alone is very different than someone who's, say, 35 and smokes a pack of cigarettes every day. Like I can have a 45-year-old woman who is completely healthy and she's taking the combination hormonal contraceptives, and her risk profile is very different than a 35-year-old who's smoking a pack a day. And so there's a curve that we look at with research, and you see it exponentially go like this once you cross someone who is 35 years old and smokes cigarettes. So we start to have this conversation with people about smoking cessation once they hit 35, because then I am moving them off of estrogen-containing birth control if they don't stop smoking. Now, granted, people are adults, and I can counsel them about the risks. And if they say, Doc, I do not want to discontinue my birth control, I will assume the risk, then I'm going to document that and continue the birth control, because imagine that risk with birth control is one thing, but then it is even exponentially higher should the person get pregnant, that they would have a cardiovascular event during pregnancy due to the high hormone status of pregnancy. Another important factor that contributes to major side effects with combination hormonal birth control is obesity. We start to see an independent risk of blood clots, heart attack, just with someone being overweight. And so you add that along with adding estrogen, and it's what we call thrombogenic, meaning the increase of clots activity. On top of that, then that increases a person's risk. And so, the average person in my clinic already has a body mass index of 30, which is obesity. So, this is something that's really concerning in our population related to weight. But again, obesity is also an independent risk factor for blood clots in pregnancy. And so we are always weighing the risks of someone's birth control versus the risk of a condition that will happen that not potentially only threatens the person's life, but they're also pregnant. And so we have to worry about managing the pregnancy as well. And so when I'm having conversations with people who have medical problems already, I'm trying to counsel them toward a birth control that doesn't have estrogen in it. But if they've been on birth control pills before, the combination ones, that's what they really want to do. Again, we're going to counsel, and it's always better that the person not be pregnant. Then the risk is always higher of these things happening to a person when they're pregnant because of the high estrogen levels of pregnancy. The other thing is, there is a lot of misinformation out there about birth control causing breast cancer. And what we know about birth control and breast cancer is that taking combination hormonal contraceptives over the courses of a person's life actually reduces their risk of breast cancer. The most breast cancers, the risk profile, if someone started their menstrual cycle really early, right, and then they went through menopause really late, those are actually risk factors for breast cancer. And what does that mean? That means people are having that estrogen stimulation of the breast for a longer period of time. And so when people are on birth control methods that inhibit their ovulation, then that's actually protective. One of the reasons that pregnancy is protective against breast cancer is because you have all of this time during a person's life while they're pregnant where they're not having that cyclical stimulation of the breast that happens through our normal menstrual cycle and the hormones. So if you kind of think physiologically about all of these things, and it starts to make sense why the risk profile changes based on people's reproductive experiences. But birth control pills do not cause breast cancer. It actually protects.
And I have one last question. Since there are a bunch of young girls that will be watching this, what age do you think would be the best time to start doing birth control?
So, I mean, honestly, when someone is considering being sexually active, which has gotten younger and younger these days, we want to be having a conversation about preventing pregnancy and preventing sexually transmitted infections and safety and consent. So the American College of Obstetricians Gynecologists recommends that even if a young girl isn't even sexually active, that they should see their OBGYN for the first time around the age of 12. And so I've seen really young girls where, you know, the conversation circles around, do you have a boyfriend? And, you know, what type of activities are you doing? And, you know, how do you feel about it? Has anyone, you know, tried to force you to do things, you know, and really start to have those conversations and help build the confidence to be able to have agency over your body and know when certain contact is not safe, right? And then the reason that oftentimes non-sexually active young girls get started on hormonal contraceptives is because of painful, heavy periods. So that is really most teens who are, I would say the average age they say now where people are starting to have sex is around 14. And so that's really young. But so it used to be that I would assume that a 14-year-old was on birth control because of their period, but now, you know, 14-year-olds are having sex. And it's not with, you know, grown men, like because of just the exposure, the earlier exposure to sex and everything, just people are having sex younger and they're having sex in their own peer group, as opposed to in the past, it was really about older people taking advantage of younger people. And but I would say that younger than that, generally, you know, a young woman is on hormonal contraceptives to control their periods. And honestly, in general, people are on hormonal contraceptives to do something to their period, honestly. Like when I'm having conversations about which method is better for a person, I'm asking questions about, well, how are your periods usually? You know, how long do they last? Do you have pain? You know, really working through those things, because then there are going to be there's going to be a method that may be better than others. I think the other important thing too is when people have certain types of conditions, there's going to be certain types of birth control that may be better. Another condition where there is where the Depo-Provera shot, for example, is one of the top tier choices is someone who has sickle cell disease. Studies have shown that the Depo-Provera actually reduces the severity and frequency of flares of sickle crises. And so that's going to, if I know someone has sickle disease, then I'm definitely going to put the Depo-Provera shot high up on the list of the better options for them.
Okay, so does anyone else have any more questions?
There are some other things that have come to my mind as I was thinking about the presentation, but just didn't have time to add to the slides, is, we have more and more people who are really getting comfortable about their non-conforming identities related to the traditional gender roles of male and female. And so I, as a gender affirming care provider, am managing people's menstruation as it relates to them transitioning from female to male. Some trans men have a lot of distress around their periods, and others don't. And so it's not, I had an assumption going in that all trans men hated their periods, but that's not true. But and the ones that do, I really want to work to stop the period quickly. And so in those people, when they start testosterone, for most people, just starting the testosterone and getting high levels of testosterone into their circulation will stop the menstrual period. But for others, in that population, actually the Nexplanon implant is really good. That additional progesterone along with the testosterone actually doesn't really result in a lot of the spotty bleeding that can happen with cisgender females. So that's a really interesting interaction that I don't know, it has been studied and probably needs to be. And then the other one that we use is the Depo shot to help to shut the period down until hopefully we get testosterone levels that are sufficient to suppress the cycle, the period on their own. The important thing about all of this is that our natural rise and fall of estrogen and progesterone in our bodies are what are powering the changes that we see that happens in our cycle, and then how that impacts the period. And so when someone's going through a medical transition, then their estrogen levels are really low. And so therefore we don't have the stimulation of the lining of the uterus to grow. And so if that's not happening, then there's nothing to menstruate, there's nothing to shed. And so that's an important piece of that.
It doesn't seem like there's any more questions, but if there's anything else that you think is important to talk about, I know you just talked about like trans stuff. If there's like anything else that you feel like us as like a younger generation should know before starting something like birth control, and like something that we need to know about how it can really affect our periods.
So there is another thing that impacts periods that is important to mention. So if you use emergency contraception, there are a couple of things to remember about that. One, emergency contraceptives are your last effort to avoid pregnancy during an act of of sex that was not covered by a birth control method. Okay, so either you're not on hormonal contraceptives and you're using condoms and you didn't use a condom, or the condom broke, or you were using withdrawal and the withdrawal didn't happen, or you're actually on hormonal birth control, but you've missed several pills and you realize, or you didn't get your next depot shot on time, et cetera, then emergency contraception is an opportunity to try to avoid pregnancy. It is the plan B that you can get over the counter is about 88% effective. And the other important thing about it is it can inhibit the ovulation completely, or it will push the ovulation out. So each time you have unprotected sex, you would have to take another plan B to cover that act of birth control. Because I've seen people are like, well, we took plan B, but they took plan B, that one time, and then kept having unprotected sex. So, and the other thing that happens is if the ovulation is inhibited or it's changed, then that's also going to impact your menstrual cycle. Because remember, with the graphic that I showed you, it is the ovulation that there is the rise in the estrogen peaks, and then there's some other hormones in there that I want to get into, and because I suspected that maybe one of the other speakers might have gone into that in more detail earlier today. But once then ovulation occurs, and then you don't become pregnant, and then there are other parts of the cycle that follow that. But then when ovulation doesn't occur, you can't expect for your next period to come when you were expecting it to. And so that then puts your cycle in a place where you don't know when you're fertile again. And so you really have to either abstain after you've used plan B until your next period comes, or use condoms, because there's no that cycle is a wash. You can't predict it, and you don't quite know. There may not be the expectation that your next period is going to come when expected. And then that's also going to throw off when your expected timing of your flow is going to be.
All right. Well, thank you so much for your presentation. It was very informative. I know I learned a lot, and especially since we're like around teenager age, I think it's very important to know this type of information. So thank you.
You're welcome. It was my pleasure.
Okay, so I think we might end the session early if you don't have anything else to talk about.
No, I mean, I can talk. I can continue to talk, but I'd rather give people their time back. I think, one of the things that I've always learned is what I've learned over time is, spending an entire time provided talking at people and not giving sufficient time for people's questions to be answered. I think that ultimately people don't retain the information very much. So I've gone to giving shorter presentations and then taking time to have discussion. And then I find that that's been better with people like retaining and actually being able to use the information. So hopefully that was the case with you all today. And I'm absolutely fine with giving you a little bit more of your time back.
All right, thank you so much. Okay, so I will be I'll be giving a link to a evaluation survey in the chat. So if it will only take a few seconds to do. It's just how much you think you learned about this session and stuff like that. So let me copy paste it. Okay, and then I guess I'll start closing up the symposium for today. Let's see. Okay, so thank you guys so much for attending. Here's a couple things that I would like to go over before you guys leave. Um, so yeah, these were today's topics, and then tomorrow we'll have two more topics. The first one is period-related diseases with Dr. Toral Mehta, and this will be from 8:20 a.m. to 9:20 a.m. Pacific time. And then for the very last topic that we have for the symposium is exercises to relieve period cramps. And this will be, the speaker will be a board member from our club. Her name is Pari Shah, and this will be from 9:25 a.m. to 10:25 a.m. PST. And so period survival kits, like I said, we'll have survival kit. Everyone that registered is welcome to come to drop by and get some. We'll be at the Kenyon High School parking lot near the staircase. In the survival kit, there's stuff like chocolate, pads, tampons, period tea, hot packets, stuff like that. So if you guys are interested, just drop by. We'll be there from 12 p.m. to 2 p.m. today, and then tomorrow we'll be there from 1 p.m. to 3 p.m. And then if you're interested in previous symposium sessions, they are all available on our YouTube channel, period at Kenyon High School. And also the sessions today were all recorded, and we'll edit them and then post them also on our YouTube channel. So and all the links to those recordings will be sent out through registrations. So if anyone missed any of the sessions, then you can see them later on our YouTube channel. And we'll also have the previous sessions from last year. So we have stuff like why do periods happen, what a normal period is, how to deal with your period, and sports and periods. So if you guys are interested, then you guys can look on the YouTube channel to watch those too. And then that would be it for today. So if you guys have any other questions, feel free to ask. If not, then you guys are welcome to leave. Thank you for attending.